Hello everyone, my name is Rahul Naresh Kavre. My roll number is 75 and today I am going to discuss the topic cardiac leukocytes with you, and my subtopics in that cardiac leukocytes are mechanism of action, pharmacokinetics, adverse effects and cardiac arrhythmias. We will see the cardiac arrhythmias in brief, how it happens, why it happens. So let's start. Uh, the brief review of this session is going to about the class medications, what is used for the treatment of cardiac arrhythmias. We will learn about the mechanism of action, side effects, preferred first line treatment, and contraindications and indications and side effects of cardiac leukocytes. So as you can see, we are going to understand the cardiac leukocytes. We will discuss the fascinating world of cardiac leukocytes and their impact on the heart. We will learn about their mechanism of action, pharmacokinetics, adverse effects, and their relationship to cardiac arrhythmias. Means what is the relationship of cardiac arrhythmias with that of cardiac? What is the relationship of cardiac leukocytes with that of cardiac arrhythmias? How we can treat cardiac arrhythmias with the help of cardiac leukocytes? What exactly the cardiac leukocytes do in preventing the disease of cardiac arrhythmias? Let we see. The brief overview of cardiac leukocytes. The definition we can see, the cardiac leukocytes are a class of medication that are derived from plants, and they are used primarily in the treatment of heart failure and certain cardiac arrhythmias. Means they are exactly derived from the plants. They are natural source, and then they are used in the heart failure diseases related to heart diseases, and we can also treat cardiac arrhythmias with that. The mechanism of action, cardiac leukocytes work by inhibiting the sodium potassium ATPase pump in cardiac muscle cells, leading to an increase in the intercellular calcium concentration and enhancing cardiac contractility. This whole thing, the mechanism of action, we have to increase the cardiac contractility of the heart. So for this, we are inhibiting the sodium potassium ATPase pump, through which we are allowing the calcium to stay inside in the intercellular calcium, by which the concentration of calcium inside the intercellular cardiac tissue increases, and this leads to the cardiac contractility. What are the let us see what are the historical uses. The use of cardiac glycosides dates back centuries, with ancient civilization utilizing paints containing these compounds of their medicinal properties. Means cardiac glycoside is used from ancient times. Name is given digoxin right now, but the product, the content, the chemical as it is used earlier. Examples. Common example of cardiac glycosides include digoxin and digoxin. The most famous example of cardiac glycosides, as you can see, digoxin. We are using in daily practice digoxin also. Let's see the deep theory of cardiac glycosides. Cardiac glycosides are a class of medication used to treat heart failure and certain heart rhythm disorders. It is basically acting on the heart related things and heart related failures. They work by increasing the force of contraction of the heart muscles, improving the efficiency. The whole thing the digoxin is doing, or the cardiac glycosides doing, they are increasing the heart working, cardiac glycosides, heart contractility. The deep theory behind cardiac glycosis involved their mechanism of action, sodium potassium on the sodium potassium pump, and their effects on intercellular calcium level. Means basically we are increasing the contractility. For that we have to increase the calcium level inside the tissue, and this is done by inhibiting the sodium potassium ATPase pump. Understanding the theory is crucial for optimizing the use in the clinical practice. If we understand the mechanism of action, pharmacokinetics about this cardiac glycosides, we can easily use this for the treatment of patients. Mechanism of action of cardiac glycosides. First is there are basically three things happening in the mechanism of action. The sodium potassium ATPase inhibition. Cardiac glycosides bind to and inhibit the sodium potassium ATPase pump, which normally pumps out sodium and brings in potassium. The inhibition increases intracellular sodium levels and decreases potassium levels. Basically, it is inhibiting the sodium potassium ATPase pump, by which the primary role of the sodium potassium ATPase pump is that they are taking sodium inside Like they are expelling the sodium and taking potassium in, but by inhibiting we are increasing the sodium levels in the cell, inside the cell, and potassium outside the cell. Second one is calcium accumulation. Elevated intracellular sodium levels impair the sodium calcium exchanger, leading to an accumulation of calcium ion within the cardiac myocytes. The increased calcium concentration enhances myocardial contractility. The primary role we have to do with the help of digoxin is that we have to increase the cardiac contractility. For this, we need calcium inside. As we can see, we have inhibited sodium potassium at sperm, so the sodium levels are already very high inside the cell. So this leads to the inappropriate work of sodium calcium exchanger. So the sodium gets exchanged with that of calcium, so the calcium comes inside and sodium goes outside. The calcium concentration increases, so the cardiac contractility increases. Indirect autonomic effects, we can see cardiac glycosides also indirectly affect the autonomic nervous system. It is acting on the autonomic nervous system, leading to increased parasympathetic tone and decreased sympathetic activity, controlling their anti-arrhythmic effect, contributing to their anti-arrhythmic effects. Means basically they are controlling the anti-arrhythmic effect by contractility. If there is contractility less, so we can use and thereby treat the anti-arrhythmias. Whatever the anti-arrhythmias, the effect of digoxin is anti-arrhythmic, so we can use it in the arrhythmias also. We will learn about the cardiac arrhythmias at the end of this topic, or at the end of this session. This is the pictorial view. This is a pictorial view of the mechanism of action. You can see digoxin is acting on the sodium potassium ATP sperm. It is blocking it, and the sodium concentration is increasing, and then the sodium potassium is exchanging sodium with that of calcium. Calcium is coming inside, and it is acting on the tone of the myocytes and thereby contracting it. As discover the intricate mechanism through which the cardiac glycosides exert their therapeutic effects to the heart. Explore the detailed flow chart and diagram below. Yes, as means I have seen what exactly we have to do. Let us see the pharmacokinetics of the cardiac glycosides. It is given by oral administration. The majority of the cardiac glycosides are taken orally due to their good oral bioavailability. They are absorbed in the small intestine and undergo hepatic metabolism. First metabolism will be happening. Then half-life. The half-life of the cardiac glycosides varies between individuals, but is generally in the range of 30 to 40 hours. Means it basically working up to 30 to 40 hours. Renal clearance. Cardiac glycosides are primarily eliminated by renal excretion, with some drugs requiring dose adjustment in patients with impaired renal functions. Glycosides is excreted by renal. It is having the renal excretion, but in case of renal dysfunctioning, means in case of renal failure, in case of renal failure, so then at the time of that we have to adjust some drugs in order to allow it to work. So let's see what are the effects of cardiac glycosides. Research suggests that the adverse effects of cardiac glycosides may be attributed to their interaction with the cellular components, leading to disruption in the channels and intercellular signaling pathways. Okay, as we can see, what are inhibited and then what happens inside the cell. Understanding this mechanism can help in development of strategies to minimize this unwanted effect. If you are using the drugs, there is some sort of side effects, and we have to contraindicate or compensate that side effects with the help of some other drugs. Let's see. Adverse effects of cardiac glycosides. Gastrointestinal effects are nothing but nausea, vomiting, abdominal pain. Cardiac effects are arrhythmias, bradycardia, heart block. Visual disturbance occurs, yellow-green color vision, halos around lights, blood vision. These all things happen when you are using cardiac glycosides. So let's see the brief review of understanding cardiac arrhythmias. Cardiac arrhythmias are abnormal heart rhythms that can affect the electrical signals in the heart. It is nothing but an antiarrhythmic effect using. We are using the antiarrhythmic effect of digoxin in order to treat the cardiac arrhythmias. They can range from harmless to life-threatening condition. In this card, we will explore the causes, symptoms, and the treatment options for the cardiac arrhythmias as well as how they can impact overall heart health. Cardiac arrhythmias and their relationship to the cardiac leukocytes. It is used in case of supraventricular arrhythmias. It is used in ventricular arrhythmias. It is used in tachyarrhythmias. What is supraventricular arrhythmias? Cardiac leukocytes are commonly used in the management of supraventricular arrhythmias such as atrial fibrillation and atrial flutter. It is used in atrial fibrillation and atrial flutter. Ventricular arrhythmias. In certain cases, cardiac leukocytes may be used as an adjunctive therapy for ventricular arrhythmias, although other antiarrhythmias are typically preferred. Tachyarrhythmias. While cardiac leukocytes may improve the symptoms of cardiac arrhythmia in some cases, they are not typically used as first-line agents for this purpose. Means in order to in order to treat a cardiac arrhythmias, where it is not the first-line drug, it's not drug of choice we are using. Additional resources for treating cardiac arrhythmias are nothing but digoxin, ECG interpretation. We can treat with digoxin. We can interpret with the ECG interpretation. As you can see, I have provided the photo of schematic structure of cardiac leukocytes, how it looks. Digoxin, a popular cardiac leukocytes medication used in the treatment of heart failure. Whatever the heart failure, heart-related disease, primarily we use digoxin. ECG interpretation, understanding electrocardiogram finding in cardiac arrhythmias. We can treat the cardiac arrhythmias by watching the ECG also and by interpreting it. Let's see some MCQs. MCQs is very important. We can check out whether our knowledge is good about this topic or not by solving MCQ. Which of the following is the primary therapeutic use of cardiac leukocytes? We are using cardiac leukocytes as basically the option. Cardiac leukocytes like digoxin primarily act on which organ? Which we already seen it acts on heart basically or primarily. Which plant is primary natural source of cardiac leukocytes? I have told you, we are obtaining digoxin from the natural source plants. The plants are nothing but Digitalis purpuri. The mechanism of action of cardiac leukocytes involve the inhibition of which pump sodium potassium. As we can see, I have shown it inside the cell. It blocks the sodium potassium pump, thereby increasing sodium, thereby exchanging with that of calcium. Which electrolyte imbalance is common associated with the cardiac leukocyte toxicity? Hypokalemia occurs. Inside a cell there is a lackness of potassium because inhibition low potassium to increase in the outside cell and sodium inside the cell. Which of the following is a common side effect of cardiac leukocyte therapy? Visual disturbance. We have seen the adverse effects, visual, cardiac and other effects. So visual disturbance, C option. Okay, thank you for watching. Thank you.